Dr. Emer, we are live.
Hey guys, it's Dr. Emer. We're here Friday showing off this amazing body, 6 days post high-def gladiator lipo. Originally coming to me for man boobs, or we call the male-female chest. If you take a look, we actually removed a lot of this genetic fat. This is very common in men. They develop this over time. This could be related to age, genetics, hormones. I've even found, especially being in California, that marijuana use can also increase it because it increases estrogen levels in the body. But now we have a more athletic, sculpted chest. It's very, very swollen right now from the fat grafting and the lift, but you can still see this border coming in. Before it was way more rounded and drooping, and it was a lot more, you could see saggy with a lot more fat at the bottom. Now when you take a look, especially if you come to the side view, see the roundedness up at the top versus the sloping before. See the edge being more defined and the nipples being lifted because we did the nipple lift and gland removal. But the biggest improvement, obviously, is the stomach. You can see more natural contour, much more of a six-pack. You guys take a look. Let's show that before. Let's show the after. Much more sculpted and defined, even with the swelling. We're doing lymphatic massage right now, pushing all the fluid into the lymph nodes and out the drains. And you can see a more natural contour where he has abs. I can feel the abs in here, and they're gonna be much more defined. A lot of this sort of stuff in here is scar tissue that's going to be released and removed from all the massaging. And when he starts working out, the skin's gonna tighten a lot more because of the plasma. Take a look at all angles here, much flatter at the bottom. Some of this related to cool sculpting that he had before. You can see that sort of, we call it shark bite or irregularities there, you guys. Now take a look, much flatter and more defined with the lipo and the heating. What are they saying there, Jordan?
People are saying how great he looks, that he did a stellar job. It's going to come in even more in weeks to come.
But what's the cherry on top, you guys? What is it? It's the arms. Take a look at these arms. Flex your arms for me. Insane. You can see the borders of the shoulder. Look at this. The back, the indentation. Let me move your arm like this for a second. Go like that just for a second. Look at that. You can see the indentation, the arm. You can see the posterior, the bicep being much more defined. Go ahead and relax a second. Flex down. Look at that. Tricep, shoulder definition, all this. There was actually some fat he had on the back of the arm that I removed, so when you pinch, look, there's literally no fat there anymore.
How many liters did you lipo?
I don't actually remember, you guys, because it's not something I typically look at, but most of these high defs were going between 3 and 5 liters. We're actually removing much more than you think because we're really pulling it in along the sides. Look over here. We're going all the way to rib. When I touch here, there is no movement in the skin. Look at this. This is just fluid. This is swelling. This is going to tighten right along the ribs. We are going superficially, removing that fat, which is very difficult to do without irregularities. We do a super wet technique, which is why you don't see as much of the result at the initial part, and it takes a few months to see, but the end result is more natural and more sculpted and more defined. I'm very excited about the roundedness of his shoulders with the fat grafting there, and super excited with the lifting of his chest, because before he had that slope and that droopiness. So this is Gladiator Lipo. Amazing results. I'm very super happy about it. Michael, tell us really quickly, why is the massage so important?
So important because it's going to reduce the swelling. It's also going to reduce the the healing process, as well as reduce scar tissue, like Dr. Emer was saying earlier, pushing into the lymph nodes and into the drain spaces.
Exactly. And the other thing is we just want to prevent fibrosis because this is a more aggressive procedure. This is not traditional lipo, you guys. This is a combination of 3 things at once. It's like doing 3 lipos. So much more swelling, much more downtime, but much bigger results. Anything else? So do me a favor, relax your stomach. Now I want you to flex it as hard as you can. Kind of like crunch down, like you're gonna squeeze your abs. Look at that, you guys. You can see where all the definition is gonna come in, all this swelling. Go ahead and relax. Much more defined. I'm super excited. The lateral borders and all the horizontal tendinous insertions are coming in, and his shoulders and arms being super chiseled. Great results at 6 days. Just wait until 3 months to 6 months when he's super ripped. Have a good Friday. Cool. That looks so good.